So I'm Becca. I am a social worker up at the University of Utah in the Department of Neurology, and I specialize in Parkinson's disease.
And I am Eva. I am another of the social workers up in our Movement Disorders Division at the University of Utah, and I work in Parkinson's and Huntington's and Tourette's and all things movement. So
Where do you do this?
at the University of Utah.
Salt Lake. You're all the way down here.
Yeah, we came all the way from Salt Lake.
Just for you. So our program within the University of Utah has actually had social workers for well over 15 years. And that was actually first implemented by our neurocognitive and our dementia physicians who really understood the importance in a neurodegenerative condition and a condition that gets worse over time of the importance of planning ahead and really implementing a proactive care planning model to help manage your disease versus waiting till everything is on fire and everything has gone radioactive and we have huge emergencies and then we try to intervene. There's very little we can do. And so Becca and I are going to be talking to you today about that proactive care planning model that we've had in place. And we have some really good data and posters and things that have been presented by ourselves and our neurocognitive colleagues. And so we're just going to go through with you guys today what we go through with every patient who's newly diagnosed with Parkinson's disease in our clinic at the University of Utah.
Can you talk a little louder, please?
Yes, we can. So I picked this quote from Michael J. Fox because this is basically essentially what we're going to talk about. It's the idea that Parkinson's wasn't really a choice that you had, and it wasn't something you walked into this world thinking, yes, I would love to have Parkinson's disease, right? But within that thing that is a non-choice, there are a lot of small little choices that you can make that will help your quality of life throughout the progression of your disease. So when we talk about proactive dementia planning, that's what we call it in our clinic because that's how it's been used, and we're in the process right now of working towards creating a proactive Parkinson's care plan. But primarily what we'll talk about today is disease-specific education, hospitalizations and doctor visits, and we'll move through that one pretty quickly because you already had a presentation on it today. Lifestyle suggestions, safety, legal and financial, expanding your care network, proactive use of respite time, planning for the unexpected, and planning for living transitions. So what we like to talk about with patients is what should you get when you meet with your neurologist? Like, what is the information that you should be receiving when you get a diagnosis of Parkinson's?
What you can expect.
Yeah, right? What you can expect. Were any of you just given medication, told to try it, and we're like, you have Parkinson's disease, and then sent on your way?
No.
Oh my gosh, that's the best news ever.
No, he spent 90 minutes with us.
That's awesome.
Yes.
Because we meet with patients all the time who don't get that information.
No, and he even told us to hold off on the med because it was a situation where we aren't ready for it yet. Because he's fairly new.
What happened was I went to a doctor here in Bronx.
Speak up, honey.
And he said, as soon as I walked in, he says, "Why are you here?" And I said, "Because I got these tremors that could be Parkinson's." The next words out of his mouth was, "You have Parkinson's." No
Take some-
examination,
Here's a prescription.
nothing.
Yeah.
And he wanted to prescribe.
Yeah.
We went to another doctor.
Yeah, and so what we liked, that's so common, and we meet patients all the time where they come in and they're like, I have Parkinson's, but like I don't know what that means, and I'm on this medication and I don't really understand it, so what do I do? And so when we talk about Parkinson's, there are really three things that doctors are talking about. One, if you have Parkinson's disease, right, that means that you have a neurodegenerative disease that is going to change over time, that affects your movement, eventually your mind a little bit, and can affect your balance and mobility. You can have a Parkinsonism, which is a tremor, or just stiff muscles, or rigidity, but not necessarily Parkinson's. But sometimes they don't actually know the difference for a period of time. And then there's another form of Parkinson's or Parkinsonisms called atypical Parkinson's. And those tend to move a little bit faster in their progression, but what happens is ultimately, when doctors see you for the first time, it's really hard to delineate what you may have because it all looks like Parkinson's. And so you might get a diagnosis that does shift and change over time. And what you should expect is either a nurse or a doctor or a different neurologist or someone that you meet with explains to you what Parkinson's is and how it's going to affect you and what that might look like. Expectations over time. Yes, this is how it affects me now, but maybe what will that look like in a few years or a few months? Or what we always like to talk about in our clinic is if you have a really rapid change in your Parkinson's, chances are it's not your Parkinson's. And we want you to go to a doctor as soon as possible because we know that this is a longer progressing disease. And we want somebody in your medical team to explain that to you so you're not like, my Parkinson's is changing from day to day, because it won't be. We want you to have medication information. What am I taking? Why am I taking it? Recommendations, and then support. Where are support groups? What are my local resources? What does it look like for me as someone living with Parkinson's? When we talk, there's this idea, right, that as we age, we will see more and more medical providers. Just happens, right? We'll see a cardiologist, we'll see a primary care, we'll see a neurologist, maybe you'll have a podiatrist, maybe you'll have a surgeon at one point. And what we want you to think of is when I'm creating a medical team of care, what does it look like? So your primary care physician manages and prevents wellness and treatment. So I get a cold, I go to my primary care. I get the flu, I go to my primary care. General day-to-day things, I have a urinary tract infection, I go to my primary care. A neurologist for Parkinson's is the person who's going to be managing your Parkinson's medications and noticing and working with you to change those over time. With Parkinson's patients, we always encourage them to be seeing a neurologist and figuring out and working with them on their medications because they're the experts in what they do and understanding your disease. A geriatrician is like a primary care. There are far and few between, but they specialize in working with people over the age of 65. That's their specialty. And so what we always encourage is if you are over the age of 65 and there is a geriatrician that is local and regional and can help you shifting your primary care towards that direction. Because what they do is they're really good at working with complicated medical conditions, which we know happens again as you age, right? Like when we talked about, you might have a cardiologist and you might have hopefully no cancer, but maybe, right? And you want somebody who understands this, understands how that's going to all interplay. You'll have a physical therapist, occupational therapist, sometime in your life to help you with knees or hips or shoulders or balance. Sometimes you'll see a psychiatrist who will help with things for mood. And then some point we would hope that you would connect in some sort of medical setting with some social worker, whether it's when you're in the hospital or whether it's in your primary care clinic. A lot of clinics these days are moving to integrating social workers into the medical field. And the social worker is really the person, and Eva's going to talk more about this, who's going to go with you in the process and explain it, because sometimes doctors use a lot of terms we don't totally always understand, or we're getting an information and it's a big overload. And so with this idea of proactive care planning, it's vital that people engage with their preferences, right? And so this cartoon illustrates when you go into the hospital and your doctor's like, so what does he want? Or what do they need? And the care partner is maybe like, I don't know, we've never talked about that. Our job as social workers is to help you figure out how to have those conversations before, like Eva mentioned, it's a crisis where you're making those decisions because you have to make them. And they're hard conversations, but research shows us that the more information we give you up front about how we can support you, actually the better the progression of the disease and the better the decisions you make for both of you in the outcome. So tips and tricks for working with your medical team. Get a medical power of attorney. We're going to talk about that a little bit more. But what What this means is if you cannot make a decision because you were hit by a car, might not even be your Parkinson's, right? You might be walking out of here, someone hits you with their car. Hopefully that doesn't happen to anyone, I'm gonna knock on wood. Then that person makes decisions for you in the times that you can't make them. And what we ask is that you fill that out and you give it to your medical team so that it's in your chart no matter where you're being seen, so everybody knows who's responsible for those decisions. You can keep it on hand. It's very hard to do that if you don't carry a purse or a briefcase, and maybe you don't want to leave it in your car. Sometimes it's not safe. But keep it in a place where you know where it is, not in that trunk drawer that you place everything in your house. And most importantly, communicate what you want with the people you designate as your person, right? If your spouse is the person who's going to make medical decisions for you, if you can't, but they don't actually know what you would want and they get handed that piece of paper for the first time, that can be a really big surprise. And so we ask that you talk about it with people.
And really crucially, kind of one of the rules of thumb we use when not just the person that you name as your medical power of attorney, but let's say something were to happen and you were to end up in the ICU tomorrow, who would be in that room? Regardless of whether or not they're your medical provider, those are the people that you want to hear your decisions and your wishes directly from your mouth. Because like we say with these documents, we don't care what you choose. Our goal is to make sure your wishes are respected. And that is much, much, much more likely if the people that love you and care about you and would be there in a crisis hear directly from you the type of things that you would want.
We want you, if you are able to use a computer and want to use a computer, get access to your electronic medical record so that you can communicate faster with nurses and MAs and your doctor. Sometimes leaving a phone call saying you're out of your levodopa might not get taken care of for 3 days and you might have ran out already, and so having access or having somebody in your life who does know how to use it have access, you can sign a release so that person can have access, whether it's a child or a neighbor or somebody that you feel safe with, and they can input that information, because nowadays a lot of medication referrals go straight to your pharmacy through our medical records.
I keep his name next to my health card in my wallet.
Yeah.
And I have 3 cards that are all together. And it's the healthcare insurance, his name as my dedicated person.
Yeah.
And the people that are going to bury me.
And what we also want is
These are the real things we have to plan for.
And we want you to think about them now and not when you're having to think about them, right? Because when we have to think about things, our brains get so close and so hyper-focused on something that it doesn't make room for us to really decide what feels best. Picking a lead care partner can really help have, again, access to your medical record. You just sign a release, so if your child is the person who comes with you to all your appointments and it's not necessarily your spouse, maybe they're your lead care partner. And you're also allowed to be a squeaky wheel, which means like you get to be annoying about the things that you need to your providers, which is frustrating for them, but look at it as like you're a consumer paying for a service, right?
I don't have a problem with that.
Yeah, and so everybody model him. Like you have to advocate for what you need because you only see that provider for 45 minutes, probably every 6 months.
15.
And then, yeah, that's not even enough time to cover everything you need to talk about.
How do you get 45 minutes?
Well, you were like you said, people will come on to that with you, so everybody else, we saw this,
You saw a good one who spends time?
she spent, earlier, one
They're
of the ladies
good.
showed that around.
Yes, and so we add this to every presentation we give because we know, like she gave earlier, hospitalizations are the #1 problem for people with Parkinson's. Hospitalizations and inpatient rehabilitation centers because your medications are not given to you on time. And so what we want is for you to always keep an account of what medications am I on, when do I take them, how often do I take them, and what medications can I absolutely not have, whether it's you're actually allergic to penicillin or you can't have them because you have Parkinson's. So what we want is for you to get this. So you'll go to the Parkinson's Foundation website and search Aware in Care Kit. And then from there, you just place an order and it gets mailed to your home. The nice part, like she talked about what's in it, is you don't necessarily have to be like, oh, I have Parkinson's disease, this is what this means, this is how it works, this is what I need. You get to be like, here, doctors, I have Parkinson's disease and you need to read the information in this book and it tells you everything that I need you to know about what I have. Instead of having to continuously remind them, you get to educate them. Because most doctors and nurses don't have a lot of training in Parkinson's disease. What we want for any hospitalization or medical visit planning is for you to talk about whether or not you have a memory diagnosis. And why we want you to talk about this with your treatment team is often it would mean that you need someone there at other appointments because maybe things aren't going through your brain as smooth as they once were. So having a second body there helps get the information through. But also surgeries and big changes and inpatient stays can be a lot harder for a person who has memory changes. Write your diagnosis on the welcome board. Every hospital room has a board, at least ours all do. I would assume most of them do. Where it says like, my nurse is so-and-so, and my MA is so-and-so, and they're on duty until from 2 p.m. to 8 p.m. You can go up there and write, I have Parkinson's disease. You can do that.
Good idea.
Yeah, and when you are going to your doctor, have an accurate list of your new medications. So if you just saw your cardiologist a week before your neurologist and they changed your meds, but they can't see your chart, make sure you're bringing all that updated information to your doctor's appointment so that they have an accurate record. We have people who show up with like just straight up bags of their medication and they're like, this is everything I'm taking. Can you update it? Which is also perfectly fine. Document any concerning behaviors or things that are happening during the day. So if at some point through your disease you start to see children running around your house, but you don't have children at your house, at sundown, like every night, document that and bring it to your doctor so that it's something that you're talking about. Or tracking your off times with your medications. Anything that you feel like you need support with, but you might not remember to talk about it in your visit. I can't tell you how many people come to meet with me who tell me about their impulsive behaviors, such as like eating, overeating, or porn, or gambling, or projects, and they've never actually told their doctor that it's a problem. And because when you're in the visit, right, your brain is like, okay, I have to focus on this, and they're going to do my test, and they're going to make me touch things and tap things, and you forget that this thing is impacting my life. Writing things down really helps.
I was given a hint by one of the nurses when I first came in, like you said, with a bag full of the prescription bottles, because I didn't remember all the names. And she took my phone. Take a picture of your pill bottle, or line them up and take a picture with the front, and then you have your medicine with the RX number and the amount you're being given, and you can put 3, 6, however many in the picture, 2 or 3 pictures in your phone, and they get all your history without you having to write it down and look for a piece of paper.
Or bring your bag of
medications.
That's a really great idea. Thank you for sharing that.
Yes.
And the last thing we always recommend is come with a prepared list of questions. Like, I'm noticing that my legs are weaker, is that normal? Or I'm having pain in my stomach. Like every other day, not every day, but maybe every other day. Are those things that maybe we should look at? And so just really you owning your visit with your provider and any provider that you see is really important to us, and knowing how to.
So the other really crucial part of why we meet with all of our patients and our new diagnoses is as much about the patients as the caregivers. And so this is actually a little bit of an older study, but this was a really great study that showed that being able to meet with a social worker to do this proactive care planning actually significantly changed and delayed the time to nursing home placement, right? So our goal as social workers is to keep you as functionally independent for as long as possible. And there's a lot of ways for us to help you plan for that and help you know how to work with your healthcare team, with your physical therapist, with your doctor, with your speech therapist to make that happen. And so some of the things, one of the big things that Becca and I often intercede with is driving considerations, right? Ultimately, at some point in the course of Parkinson's disease, you are not going to be able to drive safely. And what we tell our families a lot is that we are happy to be that bad guy. Sometimes if it's the family members, if it's the kids or the spouse trying to take those keys away or trying to make that call, it creates this power struggle and this frustrating family dynamic that you don't need to have. This is where you can work with your social worker and you can work with your doctor to help make sure. Yes, so a lot of this is about functional ability. And so there's actually really wonderful testing sites who can do a full testing evaluation, and really this is extremely helpful, and we do recommend it because, one, if you can still keep driving but you just need some modifications, they will tell you that, right? So their goal is not necessarily to pull your license, their goal is to help you drive safely. So maybe you just need some modifications, maybe you just need to not drive at night, maybe you're still safe to drive during the day. They will let you know that. But this is something especially that becomes important when we're talking about some of the cognitive changes that can come in Parkinson's. When you really sit down and think about it, driving is one of the most cognitively complex tasks we regularly do. So you've got multiple muscle groups involved, you're having to pay attention to traffic signs, to social cues, and you have to pay attention to all the other dumb idiots on the road, right? And you have to try and read people's minds and anticipate what they're gonna do. And then you have to have really fast reaction times. So driving is something that is incredibly cognitively complex. And so sometimes, if our patients especially are having difficulty with maybe insight into recognizing that they're having a harder time with driving, this is something, again, where we want you to feel comfortable as a family member and a caregiver going to the team and saying, I'm really concerned about this, and let the medical team be the bad guys.
If they have passed the DMV test, does that mean it's okay? Or are there chances that even though they passed that, they still have problems?
Absolutely, this is such a great question because it comes up. The really important thing to remember is that Parkinson's is neurodegenerative, right? So I might do pretty well on the test 1 year, but that unfortunately but truly doesn't mean that in another year's time, I'm still in that same place. In fact, what we know is that I won't be, because that's the nature of Parkinson's. And so this is an ongoing piece to monitor. Again, with your neurologist, with your social worker, with your physical therapist or occupational therapist. There's really, really good resources out there. And the biggest thing is that our goal is always to keep people as independent as possible for as long as possible. But the only thing that supersedes that is always, always safety. And the one thing that I can usually work with my patients to talk to them about is, I know at the end of the day that you would not forgive yourself if you weren't safe driving and you were to hurt someone else.
It's true.
And so it's not that I don't want you to be independent, I want you to be safe. And for
Are there
you,
statistics of how long in time it takes to progress from one stage to another to another?
Every person is different, and so even going back to your question, some Parkinson's patients will actually pass the driver's exam because cognitively they're still intact, but movement-wise, their movement might not be under control enough, or they have a tremor in their foot that hits the pedal, or it's harder to control their hand, and so sometimes it's actually not the cognitive changes, but the movement symptoms that will make it so that it's not safe for someone to be driving.
and the big one that makes sense in
Even
that.
if it's not your fault,
Mhm.
they know you have Parkinson's and
Yeah.
they're after you.
Then it becomes your fault, even if it wasn't.
And the big Parkinson's symptom to think about in this case is freezing, right? If I need to hit my brake and that's the moment that I freeze, know that's problematic.
Yeah, and we have a lot of patients who will learn to drive. They'll really focus what their off times or on times are, and they'll only drive in that 90 minutes where they're on and their meds. Or they will not drive at night. They'll start to adjust on their own
We're in the
because they get
beginning
more
stages,
anxious.
so we don't know how long to
Yeah,
wait
and
or when to expect this.
And you won't know
And he
because
drives for a living, so that's
Yeah.
why I'm asking.
well, in every Parkinson's patient, what we tell everybody over and over is your progression is going to be different than her progression and his progression and her progression.
He'll know it before I will.
Yeah, or one of our neurologists, our cognitive neurologist, calls it the son-in-law test, where you put your son-in-law in the back seat and have the person drive, and if the son-in-law feels safe, then maybe he's okay, but if the son-in-law doesn't feel safe, maybe there's some things you have to talk about.
Go to Nebraska.
And it really, this conversation is just really important because it's not an if, it's a when.
It's when.
This is something that's
We
gonna
know it's
come up.
coming.
It's something that's gonna happen, and we just want you to be able to be thoughtful about it. And be watching for it and kind of planning for it together. Legal and financial planning, the legal documents we recommend completing, of course, that advanced healthcare directive. So an advanced healthcare directive typically will have at least two major parts that need to be in it. So one is that healthcare power of attorney. So naming that person to speak for me if I am unconscious or unable to speak for myself. And the living will. So the living will is, in the case of an emergency medical situation, what kinds of medical treatments do I or do I not want to have happen? That becomes really, really important in case of medical emergencies. And then additionally, a durable power of attorney for finances. This becomes important for just being able to manage things. Finances are one thing that we know cognitively at some point in the progression for Parkinson's typically gets too complicated to be able to kind of manage in the most optimal way. So making sure you have a durable power of attorney for finances. There are some states that also have different kinds of special needs trusts. Again, this would be something to meet with an attorney about and kind of see. And then steps to developing a financial plan for care, thinking about things like Medicare and Medicaid, thinking about things like aid in attendance if you have VA service connection, long-term care insurance, hospice. These different pieces are things, again, that if you have to wait until you really, really need it, it's very, very overwhelming. But if there are things you can plan ahead and kind of do slow and steady, what's our health insurance going to look like? What are the companies that are in network for the providers we really want to see that specialize in Parkinson's? These things can be really helpful in the long run. So I'm going to go through these really quick. These are just looking at different types of medical services. And a big thing we talk about with patients is lifestyle interventions. So remembering that in Parkinson's, one of the very, very best things you can do is to stay physically active. Even it's good for all of us, but it is so, so important for our Parkinson's patients. And so we talk a lot about different ways to implement that. Both of us are diehard advocates. You're going to hear about a lot of different programs for Parkinson's when it comes to workouts. Boxing, Tai Chi, different types of, there's all kinds of programs. I cannot stress enough that the best type of physical activity is the one you will actually do. So we are realists, okay? We're social workers. We're not the doctors who are going to lecture you on like, do this, 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 and this. No, we're the people who say some is better than none, and even a little is better than none. So really, and that oftentimes if you can start working just a little bit in, it gets easier to work up to this idea of 30 minutes a day of exercise. Ideally, we would all be doing that, right? But realistically, that's not true for all of us. So some is better than none, a little is better than none. We don't need you to be absolutely perfect at working out, we just need you to work out. As much as makes sense for you in whatever form you will actually do. And then we talk a lot about staying intellectually active and socially active, these pieces that as human beings we just need. We We need to be intellectually stimulated. We need people. We're not social animals, or we are social animals.
Yeah.
None of us survives alone, right? If you leave a child out in the wilderness, they would pass away, right? We need people, and we need to be socially fed, and these things actually get more important as we age, not less.
That's
even
why I
though-
sell cruise.
Yeah, exactly.
Because they can do every one of those things every day, and they pay for it.
Exactly.
And love it.
I just want to really quickly, before we wrap up, really talk about caregiver stress. So this is one of the biggest things we really try to proactively push. It is so important for our caregivers to be taking care of themselves as well. If you are not well, you cannot help take care of your loved ones. If you're not taking care of yourself, you will burn out, and that will ultimately affect your loved one's health too. And so I really stress, I teach a lot of classes on caregiver stress, so does Becca, on avoiding burnout and fatigue. And one of the big things I just really want to emphasize again is different ways to help prevent burnout. Really importantly, again, avoid isolation. You need people. When you're dealing with a very difficult neurodegenerative disease, as a patient and the caregiver, you really need people. You need to be able to delegate tasks and ask for help and use that help. One thing that I see caregivers do that I strongly warn against is that at the beginning of the disease, they feel like, it's fine, I can manage it on my own. The problem is that being a caregiver for someone with Parkinson's is not a sprint, it's a marathon. So if you're not taking care of yourself at the beginning and doing things to help take care of yourself, you're going to hit burnout no matter what, because it's a long haul for both of you, and there's a lot of complexities involved. One of the big things that I like to stress is that sometimes we think that self-care or taking care of yourself is like, I've got to go spend $700 instead of the spa all day. Similar to how we feel about fitness, oftentimes the things that will help most are not the big things, because then once you go back into your stressful situation, you're just right back in it, and you lose all your zen and whatever else. They are often the little things. Taking time to do deep breathing every day, taking time to relax, taking time to be in nature. Often the smallest and simplest things are the things that are going to feed us the most and last the longest. So I just really want to encourage you guys to make
A small
sure.
glass of wine in the backyard.
That's it. Sometimes it's just really important. I think the biggest thing that I want to stress with you guys before we wrap up is that it's really important that it be intentional. That you have to take time intentionally for yourself and say, this is what I'm doing. I'm going to do some deep breathing. I am going to let my parasympathetic nervous system kick in, and I'm going to let all these relaxing hormones go through my brain. And I'm going to just give myself just a minute to just be human. And I just really, again, can't stress enough that if our caregivers aren't well, our patients aren't well. That is all. I think we're out of time.
I'm just gonna let you know
Yes.
there are a few more slides that we didn't cover, but we gave you these because we knew we wouldn't be able to get through everything, and so it still breaks down the other aspects, like the patient-designated care rule, building a network, and planning like for actual respite for caregivers or unexpected incidences are all there. And anything important, like we just talked about, like any quick declines, any of those things, we gave you all that information, and it's in this lovely PowerPoint. You're welcome.
I have a question, or actually a comment. If you're taking your medications and you're taking a picture, or this is true, if you're taking anything that's not prescribed, but you're taking vitamins or any homeopathic, your doctor must know
Very
about
important.
all of those things.
Very much so.
And then I want to share something with you that those with Parkinson's should know. A gentleman came to me and he said, I had trouble the last time I voted because my handwriting has changed. What do I do? So I called the registrar, and what you do is you have to go and re-register. Now, when you get to the front of the line and they give you a hard time, they shouldn't give you a hard time. There are procedures in place. Sometimes the person you get just doesn't know. So, you know, they can look at your driver's license, they can still say no to you. You be insistent that they allow you to vote, and they will find out how to do that.
That's
Thank you.
great information.
It'll be in October, it will be in our newsletter, so you'll have it for November.
Yeah, did you have a question?
I guess it's more of a personal situation one. You know, we have primary care doctors, we have Parkinson's doctors. But none of them ever referred us to what you people do.
Yeah.
How do I go about finding the person in your organization, in your specialty?
So I'm not overly familiar yet. I've only been in my job since February. I'll be very honest about that. So there's a lot I still don't know. But I don't actually know if LaRuvo has a social worker, do they?
Yeah,
I believe they do.
They
do. They have a couple.
I can
One of
answer
them
that
is
question.
Sam. Oh yeah, she's behind you. Ask for her.
My name is Jacqueline Jones, and I'm a social worker here in Las Vegas. I'm also the president of the National Association of Social Workers. The Lou Ruvo Center for Brain Health has a dedicated social worker for Parkinson's. You can consult with that person. They also have a free library. They have other ancillary services, music therapy, lunch and learn groups, and all of those types of things. But what you need to understand is that the Lou Ruvo Brain Center is also a research facility. So depending on what your insurance coverage is, they may or they may not honor whatever treatment modalities you're going to go into. And if you choose to, you just need to make sure that you collaborate with them in obtaining medical records and ensuring that you're in communication with your primary care physician as well to let them know that you're working with Cleveland Clinic, because that coordination is going to help with your treatment and care plan.
Like they referred us to a voice specialist for voice exercise and stuff. I understand that they have social, but living down here and traveling up there to go to.
Anything at
Do
UNLV?
they have lists of social
No,
workers
not right now.
that they can refer us to that are closer to our area?
You may want to, who is your insurance carrier?
Medicare and TRICARE for life.
So you're with the veterans? Okay.
They usually
So you
also
probably have a social worker at the Veterans
I
Administration?
don't use Veterans Administration.
Okay,
We can go to any place we want,
okay.
civilian, any place.
Oh, well, Big and Loud for speech, and a lot of physical therapy facilities do Big and Loud. Friends of Parkinson's is going to have a speech therapist, and part of post-acute medical is giving us a facility to do that. So twice a month. So there's a lot of things that you can do. You can call the Friends of Parkinson's office, and they can give you all the information. They can email it to you, or you can come down and pick it up. And if you're on the east side and it's hard for you to travel, they're in the process of getting a lot of those things duplicated for people on the east side.
And the other thing with your question, so if you don't want to travel all the way to, I'm not also familiar with where anything is in Vegas. If you don't want to travel all the way to LaRuvo, but you have had home health, have you ever had home health come in to help you with physical therapy or anything like that?
Only after I broke my hip.
So if you were to have a fall and need physical therapy, you can have home health, and they will also have a social worker who can help set some of these things up for you.
You know, the other thing is we were in physical therapy, and I would go all the time, of course, balance, that sort of thing. But because it's a progressive disease, I can continue to have that.
Yeah, so we tell all of our patients anytime you have a fall, people don't like to tell us when they have falls, especially they don't like to tell their doctors, but a fall triggers you to have more physical therapy. And so we like you to be really honest about falls because it means your insurance benefit kicks back in.
Yeah, we need to go because the session needs to be over. But I'll just add one thing. If your doctor is not referring you to a social worker, ask for one. Because sometimes doctors, they have so much on their mind they can't think of referring you to everybody. But ask for one. And if, that they'll refer you to one. But you just have to be squeaky wheel. That's why being educated and knowing like this educational session is so important, that make sure that the patients advocate for themselves.
Proactive.
Yeah, so let's go ahead and come on back into the room. Thank you guys, that was really
Thank you,
awesome.
you guys did excellent.